Yes.
Sorry.
Can I just ask how many suicide prevention trial sites are currently operational?
12, Senator.
Okay. And so in what way are they operational?
Well, there are 12 distinct suicide prevention sites. They all have different models they're trialling and different ways in which they're operating. We did, in the last estimates, table an update on the 12 sites and the activity going on within them, which we have updated, and we're happy to table if that would assist.
Really good. Thank you very much. So how much funding has each suicide prevention trial site actually received?
It's around $1 million for each site per year.
Can I ask if there's just for,
Yep.
for remote communities, is there any additional funding allocated for the extremely high costs of people moving around in those districts that are remote? Or are they required to provide the service in, remote northwest, Western Australia without additional funding?
So it's not a service provision, it's about funding through the PHN, a community strategy, so it's not service delivery in the same way. Of course, where we deliver services in remote areas, it's a more expensive endeavour and they're funded differently. But in relation to this, it's $1 million per site per year in order to bring together stakeholders and come up with strategies for moving forward. And it's the same amount for each site.
Right.
And that 1 million has been delivered completely to each 12 sites, or is it rolled out?
1 million per annum.
Yes, so each year it's been approximately $1 million that the trial's been operating per site.
So can you provide an update on outcomes for each of the prevention trial sites? Is that what you're tabling?
Yes, that would be the best way to do that, Senator, if that's okay.
Okay, we'll have a look at those. That's happening now, isn't it? So we can have a look at that. Yep. Please. Yep. Otherwise, I may be asking you questions that that are already on there. Recent research has shown that rate of suicide is 2.5 to 3 times higher in Australians who live within the lowest 2 quintiles of household wealth than those in the top quintile. What action is the department taking to address this inequality?
Senator, just to go back one step, so obviously there's a range of activity happening in the suicide prevention area. I can't point to a particular stream of funding which goes to particularly the issue you're alluding to, although it's one we're aware of. There is obviously higher prevalence of suicide and self-harm and so on in some communities than others, and that's certainly something that but the way the programs work is, for example, we've got a National Suicide Prevention Leadership and Support Program which invests in a range of national projects designed to reduce suicide and suicidal behaviour across the population. And that's just sort of one example. So there's a whole range of things that happen under that head. We can provide all the detail you like about the various streams, but I can't point to this is the low socioeconomic particular stream, but it absolutely, I mean, it's not the only risk factor. In fact, the largest risk factor for suicide, sadly, is a previous suicide attempt. So that's one of the reasons we're investing heavily in discharge assistance for people, working with states and territories with how we make sure people get the support after initial attempt, for example. But low socioeconomic is a risk factor, and it's one we're looking at. Now, it'd be a factor which no doubt Ms Morgan and her task force will be looking at in terms of how do we target the activity we do next, or additional to make sure we get to the risk factors that are at play.
Can you just walk me through how the department, if it's flexible enough in this instance, say for example, my community of Borroloola in the Gulf of Carpentaria, where we have suicides too often, and a lot of those suicides, a lot of the concerns that come back from family members is that they've not had the opportunity to even debrief or talk about the suicide before the next one happens. The most recent one is a brother, 2 brothers, one who died a year ago, and then his brother decided to do the same thing 12 months later on his anniversary. And so the family, or the families, just feel completely helpless, that they've got no one to talk to and no understanding of how they can help their family members to deal with these issues. How does the department, I mean, what can you do in terms of identifying particular places that are at far greater risk and it's happening far too often?
Talk about Indigenous specifically.
Yeah.
So I'm not sure if the family you're referring to, Senator, was Indigenous, but we do have...
Sorry, yes,
Yeah.
First Nations people.
First Nations people, yes. So we do have a number of First Nations specific suicide prevention programs and mental health initiatives. So of the 503.1 million youth and Indigenous mental health and suicide prevention plan, 34.1 million was for Indigenous specific suicide prevention initiatives. So 1.2 million for Red Dust to deliver social and emotional wellbeing activities in the Northern Territory, 5 million for young Indigenous leaders to participate in place-based cultural programs, and around about 19.6 million, which may be more appropriate in a way to talk through on Friday with the National Indigenous Australians Agency here, were a number of investments from them, including expanding Aboriginal mental health first aid and other activities in the Kimberley. The government's also recently announced it's providing 4.5 million for the Gayadui Proud Spirit Australia Indigenous Leadership Body to create a national plan to improve culturally appropriate care and focusing on empowering young leaders within communities, which is particularly important in relation to the issue you're speaking about.
What about in schools, Mr. Rodham, given a lot of our kids, again, First Nations kids in these instances, as young as 4, 6, 8, are either attempting or actually succeeding in suicide. What kind of work is the department doing with education?
So there are some programs specific to schools. One is the BU program being rolled out through Beyond Blue, is doing a lot of that work, and we also have a Headspace in Schools program.
And where is it? But where is the? So you said BU.
BU, yes.
Where is that being rolled out? Which schools?
I may need
pull up
to...
the brief. Give me one moment. So the BU program.
So I should say, so the BU operates in a number of schools, but particularly in relation to communities with a significant proportion of First Australians. There is a targeted pilot of BU being rolled out in the Kimberley and the Pilbara, starting in the first term of 2020.
So it hasn't started yet?
That one hasn't. The BU program more broadly, Australia-wide, has been operating since 2016-17, as funded through to 2020-21.
So is that schools in the southern states, is it?
I'm
Sorry, have you got
just
the...
trying to... I'm not sure if I...
So there's a large number of schools involved in the program across all sorts of states and territories. The pilots that Mr. Rodham's talking about were two that came on late, accelerated in the Kimberley and the Pilbara because of the concerning incidents we've been having up there with the coroner's report and other activities. So that one has been brought forward and put into place more quickly, but it is occurring across all states and territories.
Just to give you some statistics, there have been, as of the 30th of September this year, 2,817 early learning services, so they may be schools or early childhood centres, were participating in BU. 85,312 individual users had registered, and the percentage of Australian schools by state and territory participating in BU are 53% in New South Wales, 72% in Victoria, 63% in Queensland, 66% in Western Australia, 81% in South Australia, 90% in Tasmania, 91% in the ACT and 94% in the Northern Territory.
It's important to note, Senator, also that all schools and learning centres can enrol to be involved with BU. So we're wanting schools to come to it, and so can individual educators. So what we're aiming to do here is to give schools and educators the tools to be able to help kids in the manner you discussed. I mean, to go back to your previous question and the very distressing, terrible story about in Borroloola, in your area. We don't have a trial in the Borroloola area at the moment, but we do have services that outreach to that, and we are aware that we need to do more.
What are those services?
Well, mental health services across the territory. Put a Headspace in.
I'm not sure. There's all the digital.
I think the The point I'm trying to make is that we realise that this is a very difficult situation and unacceptable, which is why we're going towards zero. We also realise there's more to do. We also realise we have to move very carefully, that we don't inadvertently do something that can actually have an adverse effect. It's one on which I think it's fair to say it's a very bipartisan and very enthusiasm by everyone in order to do better for all Australians who might attempt or complete suicide, but particularly for Aboriginal and Torres Strait Islander people, because we've seen such distressing incidents that we want to stop. We realise that we're not doing enough. We realise that we don't have all the answers, and that's one of the reasons why we're really pleased the Prime Minister has appointed an expert to lead us and to provide advice on to what to do next. So when we hear stories like the ones you provided, which we very much appreciate you sharing, it just inspires us further. What do we need to do next? I can assure you that it's a very genuine commitment by the government, no doubt by all members of the Parliament, certainly by bureaucrats, and the Interdepartmental Committee, for example, that I co-chair into this, has been one of the most engaged, positive experiences as a public servant, because the whole of the Commonwealth is coming together to address this issue. So we appreciate you sharing the experience, and we'd be happy to take in any way information you've got about what's going on and see how we can respond. And together we need to move forward to do better and work towards zero.
Will those intergovernmental agencies head out to these communities?
Or
meet on those lands?
Not as a group. Ms Morgan, as she can tell you about herself, has been doing all sorts of travel, as much as possible for one person to do. She's really been out a lot. We involve ourselves with remote communities to the extent we can. Obviously, the National Indigenous Australians Agency has people out on the ground all over the place, and we certainly encourage all of agencies. So somewhere like the Services Australia obviously has people all over Australia also, and that's why they're on the IDC, to talk about how they engage with people. We're also talking to departments, industry, the tax office, or everyone, in terms of saying, where does the Commonwealth touch people? How can we make sure that that engagement is better, and that we actually together can work towards doing more about preventing suicide in Australia?
Okay. Ms Edwards, does the department coordinate which funding is granted to mental health organisations, or is this a ministerial decision?
Sorry, what was the question?
Does the department coordinate which funding is granted to mental health organisations, or is this a ministerial decision?
By and large, it's ministerial decisions, or in some instances, whole of government decisions based on departmental advice.
So what due process does the department go through in allocating mental health organisations with funding?
Well, it depends on the program, Senator. There's $5.2 billion a year spent of Commonwealth Fund on mental health overall, of which about $800 million a year is Department of Health specific programs. So obviously there's a whole range of different ways in that money's applied.
So are you able to describe the application process or the due diligence the department completes when allocating funds?
Well, again, it depends on the program. I would point that the large proportion of the Department of Health funding, the $800 million a year, about $400 million a year, something like that, is passed through the primary health networks, who are charged to research and find out the needs in their community and commission services. So that's in order to have that commissioning happening closer to the ground on the basis of needs in particular places. Other parts of that funding is delivered in different ways. So there's a range of arrangements, but we're always subject to and comply with the financial rules of the government, and make sure that that's fully accountable and appropriately allocated.
Okay. The government's announced a new suite of 64 Medicare benefit schedule items will be introduced to support a model of best practice evidence-based care for patients with anorexia nervosa and other eligible patients with eating disorders.
Yep.
Can you please confirm what consultations occurred before this announcement was made?
We might need to work with our colleagues from the Health Financing Group, I'm not sure if, because obviously that went through the MBS processes. If they're not here at the moment, can we ask that it be re-asked when Health Financing are here?
Okay.
In relation to those items? They'll be able to provide you the detail of it.
Okay.
Yeah, can I go back